Hello, my name is Tom, and today I'll be presenting on my client Mandy. Mandy is a 54-year-old woman and a persistent smoker. She is sedentary both at home and at work and has no previous exercise history for the past 5 years. Her primary condition is metabolic syndrome, but she also has a diagnosis of depression causing low mood and motivation, with a family history of heart disease. Her BMI is 53.3, placing her in the obese category, which significantly increases her cardiovascular disease risk. She reports general muscle aches when completing daily tasks, most likely due to a lipid-lowering medication. Mandy's motivation for exercise is to reduce her risk of cardiovascular disease. In turn, this will improve her mood and weight. Her medication includes Avapro, helps manage her blood pressure, Lipotron, prescribed to lower cholesterol, and sertraline, an antidepressant used to manage her depression. When working with Mandy, it's important to carefully monitor for potential side effects of these medication. We need to track her fatigue levels, heart rate, blood glucose, and blood pressure response during and after exercise sessions. This ensures both safety of her during our exercise program. Mandy's primary reason for referral is the management of metabolic syndrome, which is defined as a cluster of 3 or more metabolic abnormalities that collectively increase the risk of developing cardiovascular disease. Mandy presents with multiple risk factors that meet this definition, including hypertension, increased waist circumference and BMI, elevated triglycerides, impaired fasting glucose, and reduced HDL cholesterol. The combination of these abnormalities significantly contribute to her diagnosis of metabolic syndrome and place her at an elevated risk of cardiovascular disease and related complications. Additionally, being a postmenopausal female is another factor that increases her risk of cardiovascular disease, as mentioned in a study in 2023 by the Journal of Clinical Medicine. As you can see on the screen, secondary comorbidities include blood pressure, grade 1 hypertension, BMI classed obese, VO2 max classified as poor, fasting glucose levels pre-diabetic, postmenopausal, general soreness, and clinically depressed. As listed on screen, before prescribing exercise to Mandy, absolute and relative contraindications must be considered. For Mandy, we need to monitor carefully these listed on screen due to her hypertension, pre-diabetes, and smoking history. Mandy's goals. As you can see on the screen, we have Mandy's client goals, my short-term exercise physiologist goals, and a mention to her long-term goals. Mandy's personal goals are to improve motivation and the ability to perform daily activities with less discomfort, decrease blood pressure, blood glucose levels, waist circumference, and increase HDLs, lowering the risk of cardiovascular disease. As her practitioner, I have structured some short-term goals. Reduce waist circumference. Achieve a reduction in 2.5 centimeters in the waist circumference by the end of an 8-week program. This is measurable before and after the intervention. Research has specifically looked at central obesity, visceral adipose tissue, and the link with the development of hypertension, type 2 diabetes, and cardiovascular disease. Therefore, this will aid in the reduction of other metabolic risk factors. By the end of the 8-week program, Mandy will consistently complete her prescribed weekly exercise sessions, building towards meeting the Australian Physical Activity Guidelines for adults with metabolic syndrome. As the client has no exercise history within the last 5 years, adherence to this program and aiming to meet the Physical Activity Guidelines. It is further explored that adherence to exercise and an increase in physical activity has significant benefits on the outcome goals for someone with mental illness. Mandy will demonstrate improved functional tolerance by reporting a reduction on onset and severity of pain during daily activities, for example, hanging out clothes or stair climbing, supporting greater independence and quality of life. This will be measured through the SF-36 Quality of Life questionnaire. With the implementation of strength training, this will help in strengthening the supporting structures, further aiding in a reduction of flare-ups of muscular pain within her ADLs. With mention to long-term goals, reduction in waist circumference by 7.5 centimeters, supported by Hahn ETL, improvement in mental health through exercise and ADLs shown through the SF-36 Quality of Life questionnaire, aim to stop the use of sertraline medication for her mental health, building knowledge and confidence to continue exercise independently after not exercising for 5 years. As seen on screen, I've chosen 4 additional testing methods. The 6-minute walk test and a 30-second sit to stand test will be used to assess Mandy's aerobic capacity, muscular strength, and functional tolerance for activities of daily living, such as stair climbing and getting in and out of chairs. Improvement in these tests would reflect enhanced cardiovascular health, reduction in fatigue, and a greater independence. To capture subjective changes, the SF36 Quality of Life Questionnaire will be introduced, as this tool provides valuable insight into Mandy's mood, fatigue, and overall quality of life, which are particularly important given her depression and low motivation for exercise. Additionally, the HbA1c test will provide a longer-term measure of glucose control over a 2 to 3 month period, helping determine whether Mandy is progressing towards type 2 diabetes from pre-diabetes. RPE will be used to guide exercise intensity. Blood pressure and heart rate have shown variability within these tests. Mandy's weekly program overview from week 1 then all the way to week 8. In week 1, Mandy begins in the clinic strength training using multiple muscle groups. Short bouts of aerobic activity, 2 to 5 minutes at 40% heart rate max with breaks, and a light 5 to 10 minute self-paced walk at home. This low-intensity, short-duration approach follows ACSM's recommendations for beginners with chronic conditions, prioritizing safety, tolerance, and adherence. Research by Lang 2021 supports combining aerobic and resistance training to reduce waist circumference, which is one of Mandy's goals. By week 8, Mandy progresses to functional strength exercises using bands and Swiss balls at home and staying within the clinic with strength training. Long aerobic bouts approaching continuous sessions at 40 to 60% max, and brisker 5 to 10 minute walks at home. These programs reflect her improved capacity and move her safely towards the ACSM guidelines of 150 minutes of moderate intensity activity per week plus 2 to 3 weekly strength sessions. In summary, the program builds progressively from short supervised light intensity sessions to make her comfortable and help with her motivation to more structured, independent, and guideline aligning sessions in week 8. This ensures safety, adherence, and progressive overload, which are all essential in managing metabolic syndrome and improving Mandy's cardiovascular and functional health to help with her goals of improving her ADLs. As seen below, this is week 1 of the in-clinic program session. As you can see, prior to the warm-up, I have Mandy filling out a rating out of 10 of sleep, energy levels, and motivation prior to this session. Due to her mental health, this will help confirm how she feels prior to the session, which may reflect on the intensity we work out during the session. The warm-up mainly consists of mobility, hip opening and closing, banded pull-aparts with some cardiovascular exercise on the bike. Battle ropes add a different element of coordination to help improve our ADLs, and it's shown that short bouts of cardiovascular fitness help reduce blood pressure, blood glucose, and triglycerides, which are major components of our pathology. And we are gradually working towards the ACSM guidelines of 150 minutes per week of moderate exercise. And as we spoke about in the prior slide, Joseph 2019 supports combining aerobic and resistance training to help reduce waist circumference. The main session targets her functional goals of sit to stand and step up, with sits to stands and step up, strengthening her large muscle groups in her lower limbs, targeting that to improve ADLs. Overhead press helps strengthen muscles that help her with movements such as being struggling, hanging clothes on and off the line. An underhand row and suitcase carries help with posture control due to the amount of time spent sedentary. If you stand up and roll your shoulders in for an overhand row, you'll notice that you're really confined. If you then open your palms up and face them out, you'll then open up your chest, helping with posture. Previous research for clients with metabolic syndrome suggests resistance training was just as important as aerobic training. As mentioned earlier, due to the client's use of statin medication, this is seen to decrease muscle mass, so strength training will help in prolonging this muscle mass decrease. Strength training also reflects to help the client's goals and performance ADLs without pain. As seen below, this is week 8 at the end of our in-clinic training program. So we have changed some increase in cycling time and longer battle ropes bouts to improve cardiovascular tolerance and endurance. Strength training progressions from sit to stand to seated rows to bench squats and kneeling rows and standing press to build greater strength, posture, and balance, which are all goals. Core and functional work, so glute bridges advanced to an isometric hold and heavier suitcase carries to improve core stability and load tolerance. Aerobic capacity, so our treadmills gone from 2-minute bouts to 5-minute bouts to enhance aerobic fitness and align with the guidelines. Overall intensity has increased, sets, reps, RPE, and reflecting on improving capacity and safety of Mandy, closer to the ACM recommendations. In summary, our 8-week program is designed to reduce cardiovascular risk factors, improve functional strength and tolerance for daily life, support mood, motivation through gradual achievable exercise. Ultimately, the program progresses Mandy towards independent and long-term health improvements in line with the ACSM guidelines. Thanks for listening. References listed below.